Now, our next speaker will be talking to us all the way from the UK, Dr. Drew Provan. He is a general haematologist based in the UK, and he's also the Emeritus Reader in Autoimmune Haematology at Barts and London School of Medicine and Dentistry in the UK. Now, Drew Provan, he actually established the UK Adult ITP Register and clinical and laboratory database for ITP patients more than 2 decades ago. So he's actually been focusing on ITP for a very long time. Along with all of his other international colleagues, he's recently published helped to revise the International Consensus Guidelines, which was the starting base for Australian ITP patients before our own guidelines were recently published. And he's also reviewed and written and participated in a number of areas and papers when it comes to ITP as well. He's part of the Medical Advisory Board for the UK ITP Support Association. So all of the guys over there in the UK who are with us today, we've got one of your own presenting today. And Drew will actually be presenting information and an overview of IWISH. Now, some of you guys internationally have probably seen these results, but here in Australia, we haven't actually presented these results in full. So while Australia was not included in the initial research, stay tuned for 2.0. But what we're doing, what Drew's going to be talking a little bit about the current results, or the results from the initial study. So without further ado, Drew Provan, and talking about the IWISH results for ITP.
Thank you for the kind invitation to speak at your meeting this year. I'm Drew Provan from the Royal London Hospital. Let me just share my screen now and my slides. So I'm going to be talking about IWISH, the IWISH survey, which is the ITP World Impact Survey, which has given us great insights into the way patients feel about their disease and its treatment, and also looking at the way physicians view things compared to their patients. These are my disclosures. So ITP, primary ITP, it's a benign disease. It's low morbidity and low mortality. And most people don't have major bleeding, and not many people die, which is a good thing. So management is usually, for the majority of patients, fairly straightforward, but it has a big impact. ITP itself has a big impact on the patients. Just having the diagnosis of ITP, and also the treatment causes quality of life issues. Now, the quality of life aspect of ITP is complex and multifaceted. And previously, we had quite limited data to base things on, although we suspected patients were not happy. And this was addressed by the IWISH study, which is really good for us and good for the patients, because it provides a lot of insight into how they feel about the disease, about the diagnostic label, the treatment pathway, the treatments they receive, etc. And it also measured the differences between the patient and their views, and also the physician's views. So it involved 13 countries, around 1,500 patients, and almost 500 physicians. You can see the countries there on the right. So it covers a lot of the world. So it's a lot of data and a lot of patients. And it was done by questionnaire, and this is the patient questionnaire. The survey collected the demographic data, the diagnostic data, symptoms that the patient had, health-related quality of life and their emotional well-being, the impact of ITP on their work, on their finances, and on their support network. The treatments that they receive, this is really important, and also the patient and physician or healthcare professional relationship. And the physicians had a similar questionnaire. So looking at some of the data, the demographics, the mean age of patients was 47, which is pretty much what we found from other registries. Female, 65%, which again is very much in keeping with previous epidemiological data. They'd been diagnosed with ITP a median of 5 years before, And at diagnosis, around half the patients reported either a high or a very high symptom burden. So these are global findings. These are not country specific. I've got some UK findings in a little while. These are the global findings. So in adults, looking at adults. So the quality of life for adults with ITP is substantially reduced in ITP compared with healthy controls. And the IWISH study, as I said, was designed to look at this as well as the patient-physician perceptions of the disease. And I already said it's a multifaceted thing, health-related quality of life, but it involves daily activities, emotional health, work life, and many other aspects. So just having ITP, this benign disease, this low morbidity disease, it definitely extends heavily into the patient's daily lives. 1/5 reported that ITP impacted their ability to undertake daily tasks. These are ordinary day-to-day activities that we all do. More than 1/3 said that ITP had a negative impact on their normal capacity to exercise. And of course, it's really important to keep fit and healthy, especially during a pandemic. Almost a half reported that it affected their energy levels. And again, that affects their ability to exercise as well. And the majority, most of them, 83%, felt it was important to have a stable platelet count and a safe platelet count. But 2/3 of them were anxious about unstable platelet counts. And the patients can't easily assess their platelet counts, so that makes it even more anxiety provoking. Now, there's a really useful publication called The Numbers That Matter report, published by Novartis. So this is just a snapshot of what the cover and the contents looks like. And I've picked out a few things from the numbers that matter. So again, global. So uncertainty around the diagnosis. 22% experienced a delay in diagnosis. So that's not good if you're nervous, so you're having to wait until you know what you've got. 3/4 of those experiencing delays felt anxious, not surprisingly. 36% of those experiencing delays felt extremely anxious. And then 1/3 of patients previously treated with chronic ITP were on a watch and wait strategy. Now, satisfaction with treatment. We have suspected that patients were not happy and that maybe the doctors didn't appreciate fully the side effects. Well, if you look at physician on the right and patient on the left with steroids, fatigue with steroids, only 6% of physicians appreciated this, whereas it's 1/3 of patients, 22% with TPOs for physicians, and then 37% with patients. So there's definitely a disconnect between doctors and their patients with respect to some treatments. Patients were happier with TPO RAs and anti-CD20s than with steroids, which we could have guessed really. In terms of emotional well-being, half the patients said that the ITP had a major impact on their emotional well-being. The things that make them worry and distress are unstable platelet counts. They're worried about the disease getting worse, and 41% were worried about dying with ITP. Remember, the mortality rate is very low with ITP, and yet 41% are frightened that they may die. Patients with a higher emotional burden had more ITP symptoms. So those more stressed and more depressed and anxious experience more symptoms, which is not surprising. And steroids are also linked to a higher burden. Again, from the Numbers That Matter report, what's causing the anxiety? Why are they nervous? Well, again, the same things are on these histograms here. 41% are worried about dying. 49% said it had a severe emotional impact on their well-being due to the symptoms. 2/3 were concerned about their ITP getting worse. And again, 2/3 were worried about platelet fluctuations. 35% of patients surveyed globally were substantially concerned about their physical appearance. Again, this is probably largely corticosteroid related and also bruising, petechiae, purpura. 28% will wear long sleeve clothing to hide the evidence of bleeding. And we've all had patients who have done that. We certainly have at the Royal London. In terms of the severity of the physical signs, purpura was present in about 60%, petechiae in 51%. This is reported by patients. But look at what's reported by the physicians, it's about half that. So purpura is 60% for patients and 32% for physicians. And petechiae were noticed by 51% of the patients, but only 29% of the physicians. So it's about half by the doctors. ITP reduces the patient's ability to work, and this comes through loud and clear from the survey. 46, around a half of them were thinking of reducing their work hours. A third definitely did reduce their work hours. And again, a third considered terminating their job, ending their employment. 27% went from full-time to part-time, and 16% to early retirement because of this disease or its treatment. 10% voluntarily stopped working in their job, and 10% declined a promotion. So it's having a big impact on work. In terms of the fatigue, which we've talked about many times in many meetings, it's not well understood why fatigue is so prevalent, but it's interesting that physicians perceive fatigue as being less of an issue than patients, for example. And if you look at on the right, top right, fatigue at diagnosis, it's almost 60% of patients have fatigue when they're diagnosed. And for a half of them, it's their worst symptom. And yet doctors maybe don't readily think about fatigue. It has a big impact on their quality of life. It's linked in with depression and anxiety. And it's interesting that fatigue is not linked to the platelet count. So it doesn't mean that when your platelet count goes up to normal or at least improves, that your fatigue will necessarily disappear. It may not. So that's an interesting finding. So a couple of UK specific slides here, again, very much similar to the global findings. 83% said it had a big impact on their energy levels. 74%, 3/4, said it affected their ability to exercise. And ITP presents a severe burden on the productivity of patients. And a lot of patients, over a third, take time off work or education because of ITP. Over a third said that they were frustrated by the symptoms, and a third were terrified of bleeds, and 21% of them felt helpless. And one of the most common symptoms was depression. And I don't think we ask enough about depression. 22%. I don't think we don't explore that in our clinics, but we really should. Physicians, again, underestimating the symptom burden. You saw that earlier. Fatigue. Physician is in the light blue and the patients are in the dark blue. Fatigue is 66% for patients and 45% for physicians, so fewer physicians. Depression, it's only 3% for physicians, but 18% for patients. So we're really not recognizing depression. This is increased moderate to severe headache or migraine, 3% for physicians, 18% for patients. And then dizziness, I'm not sure why they should feel dizzy, 1% for physicians and 13% for patients. So there's definitely an underappreciation of the symptoms by the physicians. We need to align treatment goals. The treatment goals for patients on the left, the top three: healthy blood counts, increasing energy, and preventing the ITP getting worse. That's what the patient wants. What the physician wants is on the right in darker blue: reducing spontaneous bleeds, improving quality of life, and improving symptoms. So they're not quite connected. So we have used these data, which have been incredibly helpful, to make our guidelines, both the consensus and the American guidelines, much more patient-centric, trying to minimize the symptoms of the side effects of treatment, reducing corticosteroid duration and dosing as well, because that obviously has a big impact on patients, trying to get a faster diagnostic pathway so they don't have a delay to the diagnosis, etc. So these have been built strongly into the new guidelines, as you will have seen. So overall, the ITP, the diagnosis and its treatment have a big impact on their quality of life. Just being diagnosed with ITP has a big impact on their quality of life. And this was really underappreciated until we had the IWISH survey data. So the data on treatment satisfaction and the patient's emotional well-being and fatigue and depression and other aspects has really helped change our behavior. And that's why we've incorporated these into the new guidelines. And I think this survey has been so useful in providing data, and it really will help improve the patient's health-related quality of life. Thank you very much for listening.